The big fights over vaccine mandates might seem like they were ages ago, but the impact of some of them is still playing out today, including at local VA hospitals. Unvaccinated workers there who were told last summer that they could lose their jobs are now facing that very reality. And as 2 on Your Side's Danielle Church shows us, it has some veterans concerned about the future of their care.
Patients at the Batavia VA are already dealing with the challenges of staffing shortages. John McCune says he has trouble finding just the 2 nurses he needs to get out of bed.
We had to wait until they could potentially find someone to even come down to our unit.
And now they're worried it will get worse. Unvaccinated healthcare workers at the Batavia and Buffalo VAs have started to receive these letters saying they need to get vaccinated or they'll be reassigned or terminated.
I'm scared, very scared, for myself and my fellow veterans on what it's going to look like.
The VA was the agency covered under the federal vaccine mandate, but there have been delays in actually putting it into effect. A spokesperson says the Western New York VA needed time to process all the medical or religious exemptions, and that was temporarily put on pause until February because of a federal lawsuit that was eventually thrown out. Now 179 unvaccinated workers within Western New York's VA healthcare system, a little over 5% of the workforce, are worried about what could come next if they lose their jobs.
If this goes through and staff don't comply and they are fired, it could potentially put our veterans at risk due to critical nursing shortages.
This healthcare worker at a VA facility in Western New York wanted to remain anonymous out of fear they'd be fired on the spot. They say workers within the VA need to wear PPE and test 1 to 2 times a week depending on their facility, but it's not exactly easy.
It's just very difficult
to find a replacement with staffing shortages everywhere because of what the job requires.
It does take time to learn how to interact effectively with veterans who may be standoffish, need that one-on-one care. It takes time to learn how to be an effective VA employee from all aspects, all the way from EMS up through nursing and providers.
And I also did ask how the Western New York VA will handle any potential additional staffing shortages and was told, quote, similar to regional community provider organizations that have already gone through the New York state level COVID vaccination requirement, Western New York's VA will identify individualized plans for departments to enable continuation of clinical care delivery. Reporting in the studio, Danielle Church, Channel 2 News.